Thank you, Mr. Chairman, and I share Senator Conrad's view. We've never gotten out of the gate faster on this cause of health reform, and it is because of you and your white paper, and we're very appreciative of that leadership. Last night, Dr. Elmendorf, the President, delivered some very exciting news for the cause of health reform. In effect, he said after 60 years of debate, he wants health reform enacted this year, that it's time to stop stalling and to actually get it done. Now, I share Chairman Conrad's view with respect to the financing of health care. At a time when you're spending enough money in this country this year to go out and hire a doctor for every 7 families and pay the doctor $235,000 hypothetically to care for 7 families, Chairman Conrad is saying you ought to be careful about spending more before you reform the system. Now, in reading your budget books, there is not a single option, as far as I can tell, other than this tax code that produces the savings quickly. And I just want to review with you, because it's option 9, 10, and 11. I listened to your discussion about bundling reform. I happen to think that's very important. Those are savings it takes 10 years to realize. So to start with, on the tax code, and let's just do this in theory, isn't it possible to generate additional revenue that would be progressive in nature, and you touched on it in your last answer, and also serve as a disincentive to inefficient spending by reforming the federal health tax rules?
Yes.
And it would be possible to start generating those savings if, through the leadership of the President and Chairman Baucus and Chairman Kennedy, you passed it this year, you could start realizing those savings, which you have identified as progressive and a bar to inefficiency. You could start realizing those in the first year, again in theory.
Yes.
Having established that, wouldn't it be possible in theory to do that and still honor the pledges that the President made in his campaign? The President said 2 distinct characteristics of the future of health care were important to him. One, that everybody ought to be able to keep the coverage they have. And I think there's bipartisan support for that. And second, we shouldn't subject individuals, particularly the hardworking middle-class folks, to new taxes. Wouldn't it be possible to also generate that revenue in the first year and keep the President's pledges?
I think that I'm not a theorist, so I'm going to revert to a bit of the numbers. The way that the changes in the tax exclusion that we study in our book generate these savings is by having people pay tax on this form of compensation on which they're not paying tax today. So it is not, the money is not coming out of thin air, as it were. It's not coming immediately from the enhancements in efficiency. These options do lead to enhanced efficiency, as we've said, but one should not look at the number and say, well, that's this many hundreds of billions of dollars of extra efficiency. A lot of that is just, I would pay higher taxes because I taxed on my insurance.
I understand that, and I share your view. What I'm talking about, though, is tax reform, because my sense is if you pick up on what Chairman Baucus has talked about in the white paper, and a number of us have had an interest in, through tax reform, you could give a very generous deduction, $16,000, $17,000 at a time when the typical family of 4 spends $12,600 on a basic package, and also come up with new revenue in order to finance an expansion of coverage. And that's why I want to be sensitive. You can't get involved in these approaches that go to drafting a particular bill. But in theory, it seems to me you can honor the President's pledges, both of them. Keep the coverage you have and not clobber middle-class people with new taxes. And my time is about up, and I want to give you the last word.
Well, I think that maybe the last thing to say is that changes in the tax treatment of health insurance have important distributional effects as well as important efficiency effects. And when we and the Joint Committee on Taxation analyze proposals that you might put to us about changing the tax code, we will try to report on both of those, because I'm sure that both will be of concern to you all.
Fair enough. Thank you, Mr. Chairman.
Thank you, Senator.